Hello, and welcome to Plastic Surgery Tales, the podcast about plastic surgery. Today, we're going to share the intimate and empowering stories of those who have chosen to take this journey. In each episode, you'll hear firsthand the remarkable journeys of our patients, but not just the patients. We're going to be sitting down with some of the world-renowned plastic surgeons who have helped us change these lives. Welcome to Plastic Surgery Tales. I'm your host, Holiday the Golden Child. Today, we have Dr. Brewster, a cosmetic surgeon.
Yes.
And board certified for the last, since 2017.
Correct.
If I'm correct.
Mm-hmm.
Our focus today is to talk about tummy tucks and the procedure in its entirety. The consultation, the preparation, the surgery itself, and the post-op care. We want to demystify. Did I say the word correctly?
Perfect.
I'm sitting with a doctor, and I don't want to mess up with any words.
Holiday, you're number one. You're excellent.
We'll demystify each step and provide a comprehensive view. Let's embark on an informative journey, one tale at a time. So let's just jump right into it, Dr. Brewster. Cosmetic surgeon, not plastic surgeon, correct?
No,
What's
correct.
the difference?
Yeah, so first of all, I want to say thanks for having me, Holiday. I know, this is a big deal for you and me, and so I really appreciate you having me.
Yes.
All right, okay, so let's get on to the first question that you mentioned. Yeah, so at this point, there's a distinction between plastic and cosmetic surgeons. In essence, cosmetic surgeons do only cosmetic surgery. Plastic surgeons, they're like a bigger gun per se. So they do a lot more procedures. They tend to treat much more diseases and pathologies. Oftentimes in a hospital, they do reconstructive work. For example, a patient may have had a breast cancer. Which caused her to have one of her breasts removed. So as a result,
Reconstructive surgery.
Exactly. Plastic surgeons will be like reconstructive surgeons in helping to bring about restoration to that one breast that was removed. And they're fantastic at it. They also do hand surgery. They manage things like burns that can, remove parts or the entire skin. And also plastic surgeons do also focus on cosmetic surgery. However, a cosmetic surgeon focuses only on cosmetic surgery.
Which would be what would fall under the lines of cosmetic surgery.
Right. So cosmetic surgery would be things like liposuction. That tends to be a huge gamut of cosmetic.
Love
it. Yeah. So cosmetic surgery basically is a changing of shape of a normal, quote unquote, body type to obtain cosmetic changes that are desirable to the patient.
So like facelifts.
Facelifts, tummy tucks, exactly. Tummy tucks, facelifts, breast lifts, arm lifts. Any lift is usually some sort of cosmetic surgery.
So I want to piggyback off of, you mentioned the word tummy tuck, which is why we brought you here.
Yeah.
That's our focal point. Mm-hmm. Explain to the people who don't know, what is a tummy tuck and what does that procedure entail?
Very good. So a very good question. So a tummy tuck is basically a procedure that manages the lower abdominal skin and fat. So, for various reasons, usually a woman or a man would have extra fat accumulation of the lower abdomen and extra skin, which can hang and cause various problems to them. For example, usually after many pregnancies, or, if a patient was once obese, if they had a gastric bypass or some
that
sort,
hanging skin.
Exactly. So so a tummy tuck is a procedure that can help restore that normal shape to the lower abdomen. But a tummy tuck by definition is a procedure that helps to improve changes of fat and extra skin of the lower abdomen. We normally achieve this by an incision that we make. And it's very similar to
below the belly button.
Exactly.
Like that, right? Okay.
Yeah. It's normally in line with a C-section scar, that same type of area, but it goes a little bit further than a C-section scar. And using that incision, a doctor basically exposes, the fascia, which is like a glistening layer that covers the muscle. And the doctor basically goes and creates a flap of skin and fat. And it goes all the way up to the xiphoid process, which is the beginning of the chest almost. And, at that point, the doctor would basically identify the separation of the rectus muscles, which are the six-pack muscles. Yeah, exactly. And then with a suture, with a stitch, a doctor will then bring those muscles.
Tighten them.
Yeah.
Which usually happens to women who have babies.
Correct.
Sometimes as many sit-ups, as many times as you want to go to the gym, is a protrusion of the abdomen muscle, and that happens when you get a tummy tuck. You take that in.
We bring those muscles back. We restore the normal position of the rectus muscle.
I spoke to Dr. Manning yesterday, and I told him I had a breast lift, and I felt like I had a breast lift, and it felt like a reverse tummy tuck.
Yes, it is.
I've never had a tummy tuck, but what it does, the results of it, which is like it tightened the skin and it did all of those things. I like that one.
Yeah.
I like you snuck that in there, doctor.
Yeah, that's what it is. Yeah. So you're right. So by us restoring the muscle, we can improve a lot of different functions. Women who have had pregnancies, what happens too is that over time, the angle of their bladder changes, and by the laxity of the muscles. So by us tightening those muscles, those lower abdominal muscles, we can actually help to restore the urinary function, like with the incontinence and so forth.
Is this why when women have babies and they breastfeed, that they tell them to breastfeed because it'll help shrink their stomach because of the contraction of the uterus? Is this the same kind of mechanical things that are kind of doing the same thing?
It's similar. It's very similar. See, after pregnancy, when a woman breastfeeds, her brain releases a hormone known as oxytocin, and that oxytocin helps to contract the uterus,
which is also a pairing drug too, as well.
Correct. It is. Yeah.
Okay.
And then that helps to cause the uterus to get smaller and smaller and smaller, and helps to return.
Shrink.
Exactly.
Shrink the stomach.
Exactly. Shrink the stomach and so forth. So that's that reason. But yes, everything you're saying.
Should have been a doctor.
Yeah, I think so too. You're very smart. And I was going to mention that.
I should have been a doctor.
You know your stuff.
A little something. What does an ideal candidate look like, and I mean, what's the considerations for eligibility for someone for a tummy tuck?
Good question. So cosmetic surgeons and plastic surgeons alike, normally when we examine a patient in the office, this is like a very important aspect, is to examine the abdomen by inspection and palpation. What we're looking for is a couple of things. We look at the amount of extra skin. We look at how the fat is oriented, like, how much extra fat does the patient have, as well as extra skin. There's actually a scoring system called a Materasso scoring system.
Materasso.
Yeah, Dr. Alan Materasso.
It sounds like patois. Materasso.
No, Materasso. So I think he's a New York plastic surgeon. He's fantastic. He came up with the scoring system. If the patient has a score of 3 or more, we normally would recommend, some sort of abdominoplasty or tummy tuck to help, remove that extra skin that's there. And at the same time, we can bring that muscle, as we mentioned, together. It's called muscle plication with the stitch. And of course, some patients can also benefit from liposuction. Liposuction along with tummy tuck.
Simultaneously.
Yes. It can benefit the patient.
What are some of the difficult types of tummy tucks, the procedures you've had to do, and what does that scarring and after effect look like?
Very good question. So everyone is different. Usually when a patient's had a tummy tuck before, and they've had some sort of intervention, or they've lost more weight, or they've had a pregnancy, and there's a return of that extra skin in the lower abdomen, the treatment oftentimes is another tummy tuck. Those tummy tucks, those repeat tummy tucks can be difficult. Yeah.
Why?
Well, there's more scarring. Sometimes they bleed a little bit more. Every time we do surgery, the complication rate increases. Sometimes if we pull the muscle, together a little bit too tight, it can cause, issues. Sometimes if we, throw a stitch a little bit too deep, it can hit things, it can injure things a little bit, deeper that we didn't.
So you don't recommend, because I remember yesterday one of the doctors said that they don't recommend double tummy tucks. They really don't like to.
Yeah, I don't like to do those as well. But I mean, in some patients, it's the last. Exactly,
it's the last resort.
It's the last resort, and and if they're very healthy and the patient understands what they're getting themselves into, I think once you consent them properly and they understand the benefit and risks, I think we can help them.
And what aspect does the tummy tuck attack the skin, like versus lipo or someone like me? I've had J plasma on like my arms and my back.
Yes.
The skin on my stomach is so tight. I'm like, why can't everywhere else be that? And
that's
so
hilarious.
I did J plasma recently on my arms and my back. And so what's the difference in what it does to the skin?
That's a good question. That's a very good question. So if you can think about the change in a patient's skin after, say, a pregnancy or massive weight loss, what you find happening is that the patient's skin tone in the lower abdomen changes. They take on you can see like stretch marks. You can see thinning of the skin. The skin oftentimes, the lower abdominal skin, loses its ability to contract. So what a tummy tuck does, in essence, is it removes, so by using a scalpel, what a doctor does is basically remove the lower abdominal skin, okay, and attaches the more contractile or the better quality skin that's higher up with the lower skin. So basically what we're doing is we're removing skin in which the dermis, right, has been stretched.
Which is the first layer of skin.
Right, well, the first layer is the epidermis, but you're right. And then is the dermis, you're right.
So like when people have acne, 9 times out of 10, this is why like chemical pills are like very, very good because it only scars the derma.
Correct.
Now, now, what's the other layer that you like? Chemical pill can't get rid of these scars.
Correct. So if you have scars that go into the dermis or like the very deep dermis or below the dermis, unfortunately a chemical peel won't remove those.
And that's why you need the tummy tuck to get rid of those stretch marks, those skin, the extra, because it's pierced through that second, third, fourth layer.
Correct, exactly.
Got you.
And what a tummy tuck basically does, it tries to get healthy skin that in which the dermis, as you said before, hasn't been stretched out. There's no stretch marks, and we get some sort of upper skin that is of good quality, and we reattach it to the lower part of the scar.
The good skin.
The good skin, correct. And that's in essence what we do.
The good skin.
Yeah.
Will a tummy tuck help someone lose weight?
That's a good question. So, one of the fallacies, one of the myths that patients often, hear is that cosmetic surgery causes them to lose weight. That actually is not true. All cosmetic surgery does is cause a beneficial change in the body, but there is no loss of weight. Now, if a patient has some sort of loss of weight after, like in months preceding or following the surgery, it's because of some sort of intervention that the patient did by like diet or exercise, or the patient's living a healthier lifestyle.
Yeah, 9 times out of 10, I like to call it a jump start.
Yeah, there you go.
So people say to me like, why you just don't go to the gym? I said, I'm going to go to the gym after these 2 months of laying up because I'm swollen and need to heal.
Yeah.
And so I want to keep this body after letting the doctor do what he did on the table.
Yeah.
So I'm going to eat right because I want to see my best results. And so
there you go.
The jump start is, let me just lay on the table and let them help me along, because I keep going to the gym and I'm not seeing results fast enough, and it's depressing. Mm-hmm. It's more motivating after you hop up off that table. I'm just being honest, guys. I like to be honest with you. You hop up off the table, you're way more confident because you see the results that you've been working all these months for.
Correct.
And so it's like, well, let me keep it up. Now it's easy to maintain something kind of given to you. Somebody buys you a car.
Yeah.
And you didn't have to go through all this credit check and everything like that. You're more likely to keep up the car versus, and it sucks and it's bad, but it's like you worked hard for this car so bad, and next thing you know, you're leaving cups, you're leaving food, you're letting people eat in your car, you're doing all these things. You turn the corner, you get a scratch on it, like, oh, I'll fix it in months. No. Somebody gave you a car, you're like, I gotta keep this nice. This was a gift. This was, So I think we treat our bodies kind of the same.
No, you're right.
Yeah.
You're right.
we already talked about that. Can a tummy tuck remove the stretch marks? And that's a yes.
Yeah, the lower abdominal skin, yeah.
Can a tummy tuck be combined with other procedures for a more, I guess, defined look?
Yes, certainly. That's another good question. So yes, tummy tucks oftentimes feature in combination procedures, usually with breast, and the name that we give to that would be a mommy makeover.
A mommy makeover.
Yeah.
That's usually a great combination for women who have, okay.
Right, yeah. So we do quite often we do mommy makeovers, which would be like a tummy tuck plus any breast surgery, be it a breast augmentation, breast lift, breast reduction, or breast implant at that time of surgery. We can also do combination tummy tuck with BBL. However, the caveat here is that, whenever we combined a surgery with a tummy tuck, we can only do a certain amount of lipo. And that's 1 liter, 1,000 cc. So it's not much.
Yeah. So that's probably be something for a slimmer.
Correct.
A slimmer body frame of a woman. Yeah. Because a thicker woman, like, I don't think it would work. She needs, how many liters are you taking out of a woman my size?
Right. So if we're doing only liposuction, like for example, for the purpose of doing a BBL, we can take a maximum of 4 liters.
4 liters.
Yeah.
Okay. What they be taking out when they go to Colombia and DR?
I don't know.
Because they come back like
I know
this.
Those guys do good work there. But you see, what we've realized is that we have to be safe. Patient safety is number 1. And, the Florida board looked at all that, and actually at this point, there's a certain safety limit. So the 4 liters is designed to be put in place to prevent, too much lipo at the time, or because what happens is that too much lipo can cause electrolyte dysfunction.
And then you need blood transfusions.
Correct. You need blood transfusion, exactly everything, because it can cause profound anemia, where the blood count can drop to like 6 and 7, and patients present to the hospital sometimes, with anemia. They can't breathe. They're short of breath. The pulse is up into the tachycardic up into the 130s. The blood pressure is low, and they need a blood transfusion, right? And that's actually considered like a life-threatening type of situation. So you don't want your patient to get to that level. So the 4 liters is designed to be a safety guide, is designed to be put in place that we don't get a patient to that, level. Now, I can't speak as to how much is taken off in Colombia or Dominican Republic, but here in the States, and especially here in Florida, yeah, exactly. We have to have safety standards for patients.
I have a lot of friends who are like, where did you go? You look amazing. Did you go to DR? Did you go to Colombia? Because I guess the exaggeration of the lipo.
The look,
right, but I don't gain fat in my stomach and stuff. So when I do go get lipo, the 4 liters are enough for me, maybe a little less, because there's not much fat there.
Right, exactly.
And I'm like, no, I went to Miami. And they're like, no, well, I'm going out the country because they take out way more out there. And then those girls that go, they always tell, I've never had a blood transfusion in my entire essence of having plastic surgery.
Good job.
But every single girl that I know that has ever went out of the country, maybe for maybe exception of a few, always tell me they have to have a blood transfusion as if it's normal. And I'm like,
be careful.
Why are you having to have, because I'm anemic and because I'm this and because I'm that.
Wow.
And I'm like, no. Or they're like, because of the recovery home situation and out of the country, or they're trying to save money. Ladies, I stress this so much to my followers and my DMs. Like, if money is the problem when you're going to do these things, I advise you highly, highly do not do it.
Yeah.
Because it's 50% the surgery and it's 50% the post-op care.
Correct.
So you need to be able to take care of yourself afterwards. So going to these countries, these foreign countries, because the price is cheaper, and yes, you get this home care of them taking care of you out of, right after surgery and all this stuff, and that's cool, but there's a lot of other complications. You have to get back on that flight.
Yep.
You're away from your doctor if you have to contact them for any reasons. After those 2 weeks, you're no longer in that country.
Exactly.
There's just so many things that can go wrong for me. I need to be able. My doctor's Dr. Nazarati. Let me tell you, he knows. If I had his cell phone number, I'd probably be calling him in the middle of the night every night. But he's good on getting back to me immediately, and he'll tell you. I call him for everything. I'd be like, Doc, my left boob is a little hot. He's like, did you sleep on it for too long? I'm like, I did. Okay, I'll see you tomorrow. No, it's a false alarm. So I'm one of those girls.
Yeah, of course. Yeah, you need that support.
Will I have the same belly button after a tummy tuck, or will I get a new one? And before you answer this, what is the deal with the ugly belly buttons?
Right. So so you do with the standard or traditional, tummy tuck, we do create a new belly button for you. With a mini tummy tuck, we basically remove the belly button off of its stalk, its connection to the abdominal wall, and we basically float it downward. So, you in essence,
it's like the nipple when you get a breast lift.
Correct.
Okay.
So we move exactly, but we're moving it down. But you're right. With the traditional tummy tuck, we create a new belly button for you. Now, an ugly belly button, that's normally what patients refer to as a sad belly button, where the extra skin on top, the extra skin on top is making it frown. So it comes up like that, right? So, that is corrected when we make the abdominal wall more taut, where we pull the skin down and we create a new opening for the belly button to come through. So.
A lot of people don't know the belly button really has no function. I'm not saying it doesn't have a function scientifically, but meaning it's more aesthetic, something that God gave us on our body to just. He aesthetically chose how to build us up, right? And so he chose, I don't know where he came up with a belly button, God, but you just came up with it. It was like, we're just going to put this right in the middle of your stomach. Because I've also done research and seen when girls do tummy tuck, they have an option whether to keep their belly button or not to.
We should
put it back.
We should.
Is it necessary though?
No, you're right. I mean, everything you said. A tummy tuck, a belly button, is rudimentary. When we were in our mom's tummy, when we were in utero,
the umbilical cord is attached to your belly button.
Exactly. That's how we got. That's our connection to our
breathe.
mom. Yeah.
Okay.
To the placenta.
But after that.
Yeah. After that, the tummy tuck is where the blood from the placenta went into our body, and the oxygen from the placenta would go in, and CO2 from our body would come back out. So that was the vestige. That was the position where we got our nutrition. But then when we are born, it's cut, and then it becomes rudimentary. It becomes like the appendix almost, where it has no. You're right. Everything you said is true. It has no function. The umbilicus has no function, but it's actually the thinnest part of the abdominal wall. So like when doctors, like general surgeons or gynecologists or urologists, when they're doing what is called laparoscopy.
Laparoscopy.
Yeah, that's
laparoscopy.
Yeah, laparoscopy. That's where they make a small incision and look inside of your tummy. They go through that part because it's the thinnest part of your whole abdomen. So that's the part that they go in,
Wow.
So I mean, it does. You're right. Everything you said is right. It doesn't have a real function as when you're outside of your mom's tummy, but we as doctors, we know about it and we use it for many different things.
Now, speaking of children, Can a woman have children after a tummy tuck?
Good question. So, and that actually is part of counseling. So any cosmetic surgeon or plastic surgeon should counsel a patient properly about their desires in the future. So if a patient is very young and they're telling you they want more kids, that patient is not a good candidate because it means that, you're going to set her up for multiple,
surgeries.
Exactly, tummy tucks. So you're right. It should be once she's finished everything and, either her or a partner have had some sort of sterilization procedure, those are the best patients because that, there'll be no more change to their cosmetic result. This is a patient that will go on and be quite happy.
Doctor's basically saying, ladies, get the tubes tied before you come get a tummy tuck. He didn't say it, I said it, so he doesn't have to take accountability for it. I'm saying it, Holiday, the golden child.
The golden child, yeah.
Go get sterilized before you decide to have a tummy tuck.
Yeah.
Because it defeats the purpose of getting the surgery to tighten the skin, to get rid of the stretch marks, or whatever your purpose is of doing the tummy tuck, and then going to have kids to stretch it back up. One of my good girlfriends had a gastric bypass, and now she's pregnant. She found out she was pregnant, She went to go, after losing all this weight, she went to go get the skin removed. So she did this consultation that you have to do.
Yeah.
And when they came back with the pregnancy test, they said, congratulations, you are pregnant.
Wow.
So she's there to get the skin tightened and move forward with these other procedures,
And
finds out
surprise.
she's pregnant.
There you go.
I'm like, girl, you did all of that weight loss and all of that. She doesn't even look pregnant. She looked fat. And she's like, she's so mad because she's missing out on that entire process of having the baby bump because she just gained all the weight back.
Right. I know. Yeah.
Now, I can't talk. I've had a few rounds of lipo. When I start getting a bit chunky in certain areas, I be like, okay, I'm going to hit this gym for a few weeks. If I can't manage, doctor, what's up? Lay me on the table. But usually I do good for like 5-year span. It's probably like 5-6 years before I have to be like, I have to be like, doc, what's up? I know I'm back. It seems like everybody's always like, what are you in there getting now? Well, I say, don't worry about it. Just know when you see me, it's tight.
Exactly. Absolutely.
How long do the results of the tummy tuck last?
Good question. So it can last as long as, the patient, of course, maintains her shape. But, if now the biggest thing that would affect the result would be, of course, weight gain, like a change in weight. So if a patient gains more weight and or loses a lot of weight, the results will change.
The results will change. With the tummy tuck, I know you say you don't like to do the double tummy tucks, but let's just say, because I've seen girls get tummy tucks and get fat. And then they have this like protruding space in their stomach. They just get wide. Like it's very rare I see a girl with a tummy tuck that has she gets big this way. She gets more wide because of the way that you guys have pulled the skin. And so for those girls, like they can get lipo again as many times.
Well,
not as many times, but you know what I mean. Like,
lipo, yes, I've done lipo on patients, repeatedly and so forth. But everyone is different. You have to pick the right patient. In a patient who basically has no abdominal, fat, or who's had fibrosis or skin burns from lipo in the past, those patients will not be good candidates for repeat lipo. Normally, so the evaluation for anyone would be, to see the patient in the office. Of course, talk with the patient about their past medical problems, surgeries, if they smoke, drink, or use any illicit drugs, and other pertinent medical questions. And then the exam is also very important. Looking at, of course, a patient's BMI. So the BMI is something that we use in almost every patient.
I hate that. I hate that chart because it's who was that made for? It damn sure wasn't made for girls like me. Because if we look at the BMI scale, it says that I'm a 500-pound woman. Yeah. Basically.
Right.
And this is not true.
No, it's not.
And when you look at the shapes that they put there, I'm like, I look nothing like that.
I know. So I agree with you. I think the BMI is probably not the best way to calculate, body fat.
That's why the doctor has to see you in person.
Correct. Correct. But unfortunately, so you're right. The BMI is like a statistical tool that doctors use, but it's the only tool that we can get readily.
It's a metric system.
It's a metric, exactly. It's a quick tool we can get, and we can assess if a patient's obese, a patient's not obese. If the patient will be a good candidate for things like lipo, BBL.
The BMI, when they're calculating this fat, right?
Yes.
Are they calculating where it's at? Because I'm like, okay, well, when my breasts, they weigh about 40. Right. Then this 50-inch back here is weighing about that. And then my thighs, add that in. Right. We skip the whole midsection and everything else. And then I got a big head. So you understand? And then
I think you look good. You look good.
And I'm carrying a couple pounds of cat too. So
there you go.
You know what I mean? So all those things together are like
add up,
they add up.
Mm-hmm. No, so at this point, there's a device you can use that will actually calculate your percentage body fat. And it looks like things like your body water and et cetera, et cetera. So there are there are machines that can do that for you. And you're right. The BMI is probably not the best tool to actually calculate body fat, but we as doctors, oftentimes we need something quick. We need something like right there and then, that is cheap.
determine.
Exactly. That's cheap, it's quick. We can, and we use the BMI, and actually the BMI is used to define conditions like obesity, morbid obesity, if you're overweight, if you're underweight, if you're normal weight.
Right.
Right. But remember, I agree with you. We tend to use, it's a statistics tool where we can compare like populations. So we can see like Japan, people in Japan are less likely to be obese than Americans.
But they eat so much rice.
There you go.
And-
They die, exactly.
And when I went to Europe, like I went to a McDonald's,
Right.
their medium is our small.
Correct. Yeah, they always have small. You're right. They have smaller portions than we do.
They have. I feel like America intentionally is trying to kill us all because the portions of food are large.
Yeah. And we have more like sugars. I think we allow our dietary amount of sugars are a little bit higher than
are way higher. Our salt intake on certain things are way higher. And then there was this. I seen on the news that they were mad at. They were taking away, I guess, like food stamps or I don't know what was happening, but the world was mad at it. The government is mad at it because they're like, people are eating less because they're trying to get fit, and which is lowering the people going to grocery stores and buying these things because now we're pushing to be healthy, to go to the gym, to do these things like that. And I guess the government doesn't like it. I don't know. Don't come see me, but I'm just the messenger. Right. They're like, we don't like this because now you're taking money away from our grocery stores.
Correct.
It's crazy. I think the world is just trying to keep us fat and so we can die young and slow.
There you go.
Can a patient expect in terms of scarring after a tummy tuck? How can these scars be minimalized? How is there preventative measures, with these things? I'm going to say for me, after having a breast lift and breast reduction, I use this cream called Mederma.
Yeah, perfect.
I love Mederma. I also love bio oil. I tell women you should be oiling your body and moisturizing it every single day. Like, summertime. I don't live in Miami anymore. I used to 10 years. I live in New York now. And but when I was here, I was constantly, in the water, on the beach, in a bathing suit. And people would see me, in the sun. I love the sun. I love the heat. Like, I could just lay in it, and eat it up. It's my thing. And people would be like, okay, well, how don't you have, a whole bunch of stretch marks or scars? And I've had work done. And I'm like, bio oil. I oil and moisturize my skin every single day because the elasticity, for females, I don't think it's our best friend. And I think as we get older and age as women, gravity is not our best friend. Things go down, they don't go up, Maybe our sex drive goes up, but everything else goes down, So
Absolutely.
I encourage women to use these I wrote a book, it's called I'm Not a Doctor. And look at your face,
I have to go read that.
On this book, I talk about all these little tips that I use, and I say it from a standpoint of I'm not a doctor. I can only tell you what I've used, which have worked. And obviously, I have a few doctor friends, and I'm like, is this true? I use this thing also called emu oil.
Emu, okay.
And
like emu, like the
ostrich.
Yeah. Like a bird, yeah.
Yes, and it has so many great essentials to it.
Oh, wow.
It prevents inflammation. So when I got my breasts done, they were swollen and inflamed, and one was inflamed a lot longer than the other one.
Oh no!
And I used the emu oil. I also had a family member who had a knee replacement, and I would use the emu oil on his knee,
and it got better.
And it stopped the inflammation.
Wow!
Yeah, consistently use it, but right then and there, it absorbs into the skin. It has all these minerals and stuff in it that I didn't even know an ostrich carried.
Wow. Like antioxidants type, anti-inflammatory property. Wow.
Yep.
We need to study that.
Yes, please. I mean, there's no scientific proven facts behind it, but I'm a testimony to tell you that it has, and it works on scars, and it works on a lot of stretch marks, and just say moisturize. What do you feel as far as
No, I think everything you mentioned makes sense. One, wound care. Take good care of the wound. And everything that you said was totally correct. There are lots of different medical grade silicone treatments that help with keloid prevention, helps to keep the scar very, minimally, seen and unnoticed. There's also one other thing I'll probably recommend too is, and you mentioned it, avoidance of the sun, avoidance of, like environments where, there's dust and particulate matter that can get into
and cause infections.
Yeah, infections can cause inclusion cysts. So yeah, I think everything you mentioned makes makes total sense. And of course, if you're in an area where there's a lot of sun, apply sun.
If the wound is closed and healed.
Correct.
Yeah. What would you say is a good sleeping position when you have a tummy tuck?
Or lie on your back.
Your back.
Yeah. Don't lie on your tummy.
Yeah. I'm not really a missionary girl, so. But so you sleep. Hilarious. So you sleep on your back when you have a tummy tuck.
After tummy tuck.
I know this question is not on here. How long should someone wait to have sex after a tummy tuck?
Like with all other surgeries, once the incision is healed,
you get busy.
Right. So, and everyone is different. Like usually after tummy tuck, after about 2 weeks or so, Now, the problem with the tummy tuck, of course, as we mentioned, is that we plicate the muscle. So we try to restore the muscle, the rectus abdominis muscle or the six-pack muscle, and we bring that together, right? So that stitch can stay in there and needs time to
heal, exactly. or it could rip.
Well, yeah. So correct, exactly. So if you lift anything too early, if you strain, if you attempt to do something strenuous within the first 6 weeks, you run the risk of that stitch, loosening or the separation opening, or the stitch, as you mentioned, might burst or whatever. So we normally recommend that the patients don't do anything strenuous within the first 6 weeks. But I mean, if they want to indulge in exercise activity, I'll say
you have other ways to pleasure. Ladies, listen, don't let that man rush you into the situation. I just had a patient here, and she was telling me about, you got this new body. You're looking good. You're looking a little different to him now. Of course he wants it. Mm-hmm. But I tell ladies, do it on your own time. Do it when you're ready, when your body feels ready.
Correct.
Do not allow anyone to pressure you or even your husband, even your man. Tell them, listen, there's other ways we can satisfy each other. Right now, I don't want to bust a stitch. Literally. Can I use a faja after tummy tuck?
Yeah. Especially on patients in which we do like lipo of the back, lipo of other areas. Yeah, faja, like an inner thigh. Yes, a faja would be beneficial for those patients.
Because I was told some doctors don't like using fajas after a tummy tuck, especially like for the first month or 3 weeks.
Yeah. So and actually that also is valid. But once you use a tummy tuck with the abdominal binder, that's gold.
It's gold.
Yeah, that's like Holiday the Golden Child.
Hello. Welcome to Plastic Surgery Tales. Dr. Brewster here with us. Let's introduce him. If you're just catching up with us and you're just getting here, make sure you guys are liking, subscribing, commenting. Put in those comments the questions that you have for any of the doctors that you see here, guys, so we can ask them these questions, because we want to solve. We're problem solvers here at Plastic Surgery Tales. So we're trying to solve all these questions that are going unanswered.
Yes.
And, everybody doesn't have first responder of access to these doctors like I do. So I'm just trying to be the gatekeeper who is giving the gems and giving everybody all this good information that they need. Because I wish that somebody, there was a Holiday the Golden Child when I first started my surgery journey, who was willing to share. It was like top secret.
I know.
Like, I'm getting surgery. I'm getting this. I'm getting that. And I was just like, and then when I started doing it, I was sharing it. I was documenting it. I was telling the world, and everybody's just so shocked that I share. I was like, but the results turned out so well. Mm-hmm. Why would I not tell you where I've been and who I went with and what my experience was? You know?
Yeah.
How do you approach post-op care to ensure the long-term success and satisfaction of a tummy tuck with a patient?
Good question. So post-op care, as you said before, is very, very, is vital. It's very, very important.
Yeah.
So I forgot to mention to you at tummy tuck, like just before we close, we place 2 drains under the skin. So after surgery,
Doc, I hate drains.
yeah. So after surgery, it's important for the patient to follow up to, of course, have those drains removed.
But why?
Why?
Why they can't just leak like, like I like leaking. I'm okay
Right.
with leaking.
Yeah, but you see, unfortunately with a tummy tuck, doctors have to dissect a large area of skin, and how the body, so when we put those layers back together, how the body wants to heal that is that it wants to fill that space between those layers with things like fluid, with things like blood, and if the fluid stays there for a while, it can turn into an infection. If the blood stays there a while, it can turn into an infection. Patients can have fevers, and it can turn into like a cyst. It can turn
Sounds
into
terrible.
Yeah, it can turn into big scar tissue. So the drains are there just to help remove all of that blood, that extra blood that wants to collect there, all that extra fluid that wants to collect there, and just gets it out there.
What advice do you have for an individual considering a tummy tuck?
Yeah, I mean, listen to podcasts. I think so, and I think you're right. I think we need to be more open. Because traditionally, whenever a patient made a decision to have cosmetic surgery, it was always very discreet. They wanted no one to know.
No one to know.
Yeah, because oftentimes it would be these like A-class celebrities, and they would they had this aloof personality where they're perfect, the bodies are perfect and so forth. But I think
we know the secrets.
Yeah, but I mean cosmetic surgery is accessible, to many different people.
Yeah.
But of course, if someone is selecting or they're considering this as something to improve their quality of life, they should they shouldn't settle for one doctor. They should look around.
Do your research.
Right. Yeah, and most importantly, have consultations with doctors. I would recommend, going to at least 3 doctors, see which doctor clicks with them, see, if they like the doctors before and afters. Research the doctor, make sure the doctor is doing this.
He fits your liking.
Right. No, well, to see if this doctor, is board certified in the specialty, has been doing this for quite a while.
Right.
And if the doctor has had some sort of unfortunate event, have the doctor explain to you what happened, if they can, or if they can't, But what research a doctor, that's important. And then, of course, as I said before, try to get as much information regarding, how to prepare for this, what to expect. If a patient has had like an issue with anemia in the past, they need to take iron pills to strengthen their body for the surgery, because cosmetic surgery is elective surgery. It's not emergent. It's not.
So you're putting your body through trauma that it really doesn't have to go through.
Exactly, but more importantly, if a patient has diabetes, hypertension, all of that stuff should be controlled. A patient who is thinking about cosmetic surgery should be optimized, meaning that they shouldn't have any sort of disease process that is ongoing, or they shouldn't have any.
Because this might make it worse. The trauma to the body will definitely affect anything else and
heighten the risk for infection, for damage, for bleeding, for you name it.
It's terrible.
Yeah.
I always like to go off of I like to go off of the grid a little bit and not just say, what the questions that they have here for me. I definitely want to know, what made you want to become a doctor?
Oh, that's a long story. So
give me the synopsis.
Yeah. So I'm from a very small island called Trinidad and Tobago. And my father is a
Trinidad
and Tobago. Yeah. So my dad's a doctor there. And, I, in a way, saw what his routine would be. And I always envisioned that for myself. So I guess I was familiar with the lifestyle at a young age. And, I just thought it would be a good profession.
And lastly, before we get out of here, we love a little spicy information on the doctor, because there's a lot of ladies watching. So they want to know, like, is Dr. Brewster single? Is he married?
I'm married.
You're married?
Yeah, with kids.
With kids.
Yeah.
Okay. Yeah, ladies, he's taken.
There you go.
Unfortunately. And lastly, I know a man's always going to say his wife is perfect, but if you could choose the ideal surgery to do on your significant other, what would that be? We won't tell. It's not a secret.
Surgery, I think, as you said, I think my wife is perfect just the way she is. But, I think the older we get, like fillers and Botox to the face, I think is something, people try to do to help aging,
Yeah.
So I think, she probably could start on some sort of maintenance like that. But besides that, I think she's beautiful.
She's beautiful. Love that. Listen, Dr. Brewster, he has been board certified since 2017, and he took time on his busy day, because I know he has to get back to the surgery table.
Yes.
But we are here at Plastic Surgery Tales, here at New Life Plastic Surgery. I'm your host, Holiday the Golden Child. I want to thank you for sitting down with us.
Thank you too.
My fellow Trinidadian.
There you go. Trini in the house.
Trini to the bone.
There you go.
So make sure you guys go like, subscribe. Again, I'm going to drill it in your heads until it's stuck there. We love you.
Yes.
Make sure you guys return. And we got some more tales
Yes.
to sit down and talk with you guys.
Okay. Bye, guys. Thank you.